Hello everyone, I am Dr. Umar Karadan, Chief Neurologist, Baby Memorial Hospital, Calicut. So today I would like to speak on a very common but frequently undiagnosed condition called restless leg syndrome. This is quite common. This occurs around 5% of the population throughout the world. It occurs both in males as well as females, with the peak incidence in the third and fourth decade of life. Very rarely this runs in families, but usually it doesn't occur in families. So what are the symptoms of restless leg syndrome? The people or the person will have severe burning, tingling, paresthesia, numbness, pain, aches and pain, which may them with an urge to move and walk about. So they will be restless. They will have some pain and tingling and pain, which may make them move about or walk about, and they even go on smashing, touching, stretching, and doing so many things to relieve the tension as well as the pain. And whenever they are at rest, like when they are watching a movie or they are free at home, or when they are trying to sleep, this occurs, and this causes more distress, so that it would lead to anxiety, depression, and very rarely it can lead to hypertension and cardiac ailments as well. So it is quite common, and usually this gets diagnosed only after 1 or 2 decades, maybe 10 years or 20 years. And till the time the patient used to suffer this pain and restlessness, this leads to insomnia or lack of sleep. So it is very important to identify this condition so that we can treat them, or if there are any factors which would lead to this restless leg syndrome, because basically there are two types. One is the primary restless leg syndrome and the secondary restless leg syndrome. So the symptoms are the same, but in the case of secondary restless leg syndrome, there are various causes like diabetes mellitus with neuropathy, or the involvement of the nerves due to uncontrolled high blood sugar. Second thing is, if there are problems with the thyroid gland, sometimes that also causes this problem. Renal dysfunction or any kidney problem, or those who are undergoing dialysis, or those people with rheumatoid arthritis, those with a deficiency of various vitamins like vitamin B12 deficiency, folate deficiency, low blood magnesium level, or rarely due to certain drugs like fluoxetine or antidepressant or antipsychotic medication, verapamil, and other drugs. These drugs can also sometimes lead to restless leg syndrome. In 30% of the pregnant people towards the third trimester, they would experience this sort of pain and paresthesia, tingling, numbness in the feet, especially at night. So that's also quite common, but usually, fortunately, this would improve once they delivers. Okay, so the symptoms that I've told you earlier, this mainly pain, numbness, and paresthesia, aches and pains, which would prevent them to getting into sleep. The investigations are rather simple, like check the blood sugar, blood studies, blood counts, renal studies, ferritin level, check the iron, B12 and folic acid, like that, and look for any renal failure, rheumatoid arthritis, and always look out for some other secondary cause like peripheral neuropathy, radiculopathy, fibromyalgia, and other condition which would simulate this condition. So once you feel that the patient has or the person has this sort of symptoms related to restless leg syndrome, you have to treat them. Okay, so you have to differentiate whether it is due to a disc problem, whether it is due to a neuropathy, whether it is due to renal failure, whether it is due to diabetes, or due to some medicines, or occurring without any known cause. It's called idiopathic restless leg syndrome. Very rarely this can involve the upper limb. Then it will be called as a upper limb variant of the restless leg syndrome. I have seen 2 cases of a genital variant of the restless leg syndrome. So once we treat the cause, like if there is some iron deficiency, this we have to treat that condition. Then only this improves. Then secondly, there are various medication like we can use iron supplementation, levodopa, carbidopa, as well as the pramipexole, ropinirole, and other medication. All right. Very rarely, if they are not improving, we can add some certain medication like pregabalin, gabapentin, clonazepam, and supplementing magnesium, vitamin B12, folic acid, iron, like that. So, in order to avoid this, we should have a certain life habit. You should change your lifestyle, like smoking should be stopped, alcohol should be curtailed, or it should be reduced or stopped, and please avoid taking caffeine tea, or either you stop it or at least discontinue those tea and coffee in the evening hours. Then do some exercise in the morning hours, and like stretching and sort of good exercise every day. You make it a habit that because if you do regular exercise, this can reduce or even abolish the restless leg syndrome. And avoid daytime naps. You should have a sleep diary, at what time you go to sleep, and you should have a diary, and you continue according to that. So you set a pattern. All right. Secondly, you should try to massage. You can have a hot fermentation or stretching and other maneuvers just before going to bed. So, first of all, you should identify if there are any identifiable cause like anemia, renal failure, or any systemic illness which should appear or manifest in this way. So, treat that. If there are any iron deficiency, treat that iron deficiency or vitamin D deficiency. Any other endocrine or other rheumatological illness, treat that. And symptomatically, you can treat with the, you can take the advice of a doctor who would prescribe you certain medicine like levodopa or ropinol or pramipexole. So this would be quite effective. So I would like to thank you for spending your valuable time with me, so that I think this is quite fruitful for you. Thank you very much. Bye.